Hi, my name is Cassidy. I'm a nurse practitioner. Today I'm going to be doing an assessment of your abdomen and your blood vessels.
Okay.
Do you have any questions or concerns before we get started?
No.
And I'll begin by having you verify your name. You just use your initials and your date of birth.
BK 6/24/2000.
Okay. So getting started, I'll have you lie flat on your back
Okay.
with your arms to the side. And I will have you lift your shirt up just to expose your abdomen. So starting off with inspection, I'm just looking at the abdomen. I'm looking from the front, from the side, and then down by the patient's feet. Okay, so the abdomen appears to be symmetrical. There's good venous return. There's no areas of discoloration. I do see some moles noted, but I don't see any scars. Okay, good. And there's no stretch marks. So next I'm going to have you lift your head, kind of in a crunch-like good position. So with this, I'm looking for any muscle separation, any hernias, any masses. Again, looking from the side and down by the patient's feet. Good. So none of those. So next with auscultation, I'm going to use my stethoscope and listen to each quadrant of the abdomen. I have 5 minutes to listen to each quadrant before I could say that the bowel sounds are absent. And if I do hear bowel sounds, I'll just move up to the next quadrant. So beginning with the right lower quadrant. The right upper quadrant. Left upper quadrant. And the left lower quadrant. Good. So the bowel sounds are present and they are normal. They are not hyper or hypoactive. So moving on with auscultation, I'm going to listen using the bell of my stethoscope for a bruit. So we have the aorta, the right renal, the left renal artery, right iliac, left iliac, right femoral, and the left femoral. And there's no bruit heard. So next, moving on with percussion, you're going to feel me lightly tap each quadrant of your abdomen. So the sounds are equal and bilateral. There's tympany heard over all quadrants. Next, I'm going to percuss over the liver to get a measurement of the liver span. So I will start above the liver. And below the liver. Okay. So next, grabbing my measure tape, I'm going to measure that area. And it is 8 centimeters, which is a good finding. Normally the liver measures 6 to 12 centimeters. Now I'm going to percuss over the spleen. And take a big deep breath and hold it. Good. Breathe like normal. So there's tympany heard over the spleen, which is a good finding. Sometimes when the spleen is enlarged, you'll hear a dullness, but the spleen does not appear to be enlarged. So moving on to light palpation, I'm going to begin by lightly touching the 4 quadrants. I'm feeling for any muscle resistance, any masses, any bulging. As I do this, I look at the patient's face to look for any facial grimaces, any pain or tenderness during that. So now I'm going to begin with deep palpation. I'm going to palpate all 4 quadrants again. Again, feeling for any masses or bulges. I'm gonna palpate over the umbilicus and the umbilical ring, looking for hernia or masses. And none of those are noted. I'm next gonna palpate for the liver using 3 techniques. Okay, I'm gonna place my hand behind you. Take a big deep breath and let it out. And now I'm gonna come behind the patient, place my hand under the rib cage, big deep breath, and let it out. Okay. And the liver does not appear to be enlarged. I'm gonna palpate the spleen. I'm gonna place my hand behind you and kind of tilt you at an angle. I'm gonna place my hands by the rib cage about 30 to 40 degrees, and big deep breath, and let it out. Okay, good. So the spleen does not appear to be enlarged. I'm gonna palpate for the gallbladder. For the kidneys, I'm going to place my hand behind you. Okay. So now I'm going to place my hand on your stomach and I'm going to feel for any aortic pulsations. I don't feel any of those. And now I'm going to percuss over the gastric bubble. Okay. And tympany is heard over the gastric bubble. So now I'm going to have you sit forward. And go ahead and kind of angle your back. I'm going to locate the costovertebral angle, and I'm going to percuss for any kidney tenderness. So again, let me know if any pain or tenderness is felt.
Okay.
Any of those?
No.
Good. So you go ahead and move forward. So moving on to the blood vessels, I'm going to locate and palpate the blood vessels. So I'm going to begin with the radial. The rate and rhythm is equal, and it is a 2+ in amplitude. Then we have the brachial. Again, rate and rhythm is equal, and amplitude is 2+. I'm going to have you take your socks off. And I'm going to palpate the dorsalis pedis. They are bilateral and equal, rate and rhythm is equal, 2+, and then we have the posterior tibial. And again, rate and rhythm is equal and 2+. So next I'm going to palpate the upper extremities. The skin is warm to touch, the hair is evenly distributed, the moisture is good, I don't see any dry areas. I'm going to do some capillary refill. So the capillary refill is brisk, the blood returns in under 3 seconds. The skin and nails look good. Go ahead and go like this. I don't see any clubbing of the nails. So now I'll do the same to the lower extremities. I'm checking for a capillary refill. And the refill is brisk, returns in under 3 seconds. And now I'm going to palpate the lower extremities. I'm checking for any edema. Again, the skin's warm to touch, the moisture is good, no dry areas, the hair is evenly distributed, and no edema is noted. I don't see any varicose veins, any muscular atrophy. Okay, so now I'm going to palpate the carotid pulses, and I'll do these one at a time. And now using my stethoscope, I will listen for any bruit. And for this, I'll use the bell.
Okay.
And hold your breath. You can breathe like normal. And hold your breath. Okay. And I don't hear any bruit. Next, I'm going to look at your jugular vein, so I'll have you lie flat on your back. Keep your head straight. You go ahead and turn to the left. Okay. And the other side, I'm looking for any distension, any pulsations of the jugular vein. Okay. So now I'm gonna put your head under a pillow, kind of angle you at a 30-degree. And look to the left. And then to the right. Okay. So there's no distension of the jugular vein and there's no pulsations noted. Go ahead and step forward. Well, that concludes our assessments. Do you have any questions for me?
No, I don't think so.
Okay, thank you for your time.
Thank you.